We're on the road. Where transportation goes, community grows. Welcome to On the Road with the MTA.
And welcome to another edition of On the Road with the MTA. I'm Jay Gibbons alongside with Stephanie Kay from the MTA, who's working remotely today. How are you?
I am. I got to tell you, I do kind of like working remotely. We were talking about this off the air, and I feel like I'm a lot more productive when I'm at home because I realize I have to be right on my computer or right by my phone so they know I'm working here. And at work, sometimes you go down to the kitchen area, or you have lunch with people, or you go and chat with the coworkers, and you miss some phone calls. So I think I'm more productive at home. I kind of like it.
And you know what another thing is? You know what another thing is, don't you? Is like when you're at home, you're next to the kitchen, you tend to eat more.
Oh my gosh, I just finished lunch. You're so right. And I'm looking at a box of milk duds that over there is waiting for me to come back over. That is so funny.
Did you steal someone's candy or something, Stephanie?
What's that?
Did you steal someone's candy, milk duds?
No, this isn't a Halloween size. This is a big mommy size. I get this from a dollar store, which is now $1.25, by the way. And that being said, I'm sure we all have a lot of Halloween candy left behind. So what'd you guys give out this year?
Oh, mine was, I don't get too many trick-or-treaters at my house, so I went big and got those big candy bars and passed those out, because I might have 10 or 15. I have a very small amount, so.
Well, I give the big candy bars, too, because I feel bad. They come all this way. They have to have a lot of, I just say, take what you want, and they get so excited. And what I saw on Facebook is everyone mentioned the same thing. This year, there were like teenagers, but they were all so polite and grateful. And it was so nice to see that we're out soaking windows. They were out having a good time, trick-or-treating, and everybody was so much more polite. I think having COVID made us stay home, and now we appreciate being outside.
Yep.
Well, I think there's more of these trunk or treats, and I know Keller Williams did one in Grand Blanc, I believe. I thought he said a couple thousand people showed up for that. So
wow,
that
really?
Must be where everybody is going.
Yes, that's probably for the little kids, and then maybe the bigger ones go door to door. But I was glad to see that they were out there having a good time. So, yep. Well, good. And I know, Jay, what'd you give away for Halloween? Did you have anything left you could bring to the office next week?
Well, I didn't give away anything. I just went around stealing candy. That's all. No, just kidding. I didn't really do that. No, seriously.
That's our Jay. That's great. We'll talk about giving things away. I got to say, we're so lucky to have Jim Milanowski on the air with us today. He is the president and the chief executive officer of Genesee Health Plan. And if you guys are not familiar with Genesee Health Plan, it's like trick or treat every day. They give away things all the time. It is a nonprofit healthcare organization that provides basic health services to the uninsured residents of Genesee County. And I know when Mike and I were on the morning show together and they made the change, he and I went down to the Genesee Health Plan, and we were both so impressed with how knowledgeable people were, how kind and welcoming they were. And we had coverage that gave us such a sense of security that we had until we had found new jobs, which mine is now at the MTA, working right now with the podcast and what they do in the community. And now I am so grateful to say we partner together with you at Genesee Health Plan, getting people transportation to where they need to go. And you guys have so many wonderful things coming up. And that's why I asked you to be on with us, Jim. I know you're doing a healthcare phone bank on WNAM TV5 on the 16th of November. Can you tell us more about what that's about and how we can help?
Oh, yes. We, on November 16th from 5 to 6:30, another partner, just like you guys at MTA at Channel 5 News, is having one of these phone banks, just like the old Labor Day telethon type deals
MTA,
where operators answering the phones. Well, we're not collecting any money, but we are, our staff, and we're going to be joined from partners because we can't do this by ourselves. So we have people from the Greater Flint Health Coalition, from Hamilton Community Health Network, the Valley Area Agency on Aging. That's usually a tongue twister for me, but they work a lot with seniors in our group. Those are the staff and our staff at Genesee Health and our enrollment staff are going to be answering the phones to answer questions about healthcare enrollment. It is open enrollment into healthcare for Medicare and the healthcare.gov, Obamacare, whatever you want to call it. So we have experts on the phone that will take calls. But I know I've talked with you and been on these podcasts before, Stephanie, where healthcare is confusing. It's not easy. If it was, we'd probably be in a lot better shape than we are in our healthcare. So Right now, especially open enrollment in Medicare started in October, and it runs through October 7th. And seniors, I know, are bombarded with mail and calls. Choose our Medicare Advantage plan, choose our plan, and it gets really confusing. And so these operators will be able to assist people in answering their questions. So someone might be calling and saying, I don't have any health insurance. What should I do? So we'll have staff available, and during that 5 o'clock to 6:30, and then there's going to be cut-ins at the during the news to show that and to give out our number and so forth.
Well, that is incredible. I didn't realize you were doing that. I thought you were looking for help and some money, but this is just information that you're giving out for free. Like I said, you are a cross between trick-or-treating, giving people free stuff, and Santa Claus, because you're helping so much. But
well, yeah. We have found this last time we did it. It's really interesting. We've done this a couple of times, and the phone just rings off the hook. And I feel bad because it's mostly seniors who call, because a lot of times they're watching the news and they just don't know what to do. And so our staff, they can make appointments, or they can call our staff at Genesee Health Plan, and they can make an appointment, and we can go and make sure that that person gets signed up for, let's say, Medicare Advantage, what plan would work best for them, and make sure they're choosing wisely. So, and so they can talk about that on the phone bank, as well as how they can make an appointment to get one-on-one assistance, because trust me, it is confusing.
Oh my gosh, is it ever? I was just helping my mother go through hers, and then my sister came in and said, I have questions too. And you have a great staff, because we called Tammy over at I know you have two Tammys working there. Tammy, yes. Yeah, Tammy G. My mom said, oh my gosh, I know she has to be so busy, but she never made us feel like we were bothering her or she was rushed. She took her time to answer our questions and told us how we could do more research to find out what's best for us. And you guys are just an amazing wealth over there, just such a great resource that people need to know. So I know you're located at 2171 South Linden Road. What if somebody's wanted to call and have a question for you now? Can they call you anytime to ask these questions?
Absolutely. So, we're open Monday through Friday, 9 a.m. to 5 p.m. And they can call us at 810-232-7740. Again, 810-232-7740. And we can answer those questions, or again, some of our enrollment staff would be available, or they can make an appointment. I'm glad to hear that about your mother, but that's very, very typical. You think you're smart, and, I can handle this, and you help somebody. Like, I helped my older brother a few years ago. He's older than me, and I was trying to help him sign up for Medicare Advantage. And I made a huge mistake. I thought I chose a plan that his primary care physician took. Well, no. So I should have just gone with my staff and let them help. So I learned my lesson the hard way.
Well, I know my mom said many times, what do people do that don't have children to help them? Because she's just so grateful that I have a lot of connections or resources for her too, and take the time to go over to her house and make the phone calls. But when I called Tammy, and she spent an hour on the phone with us trying to walk us through it, and so patient. There's so many different programs and so many different ways you can go. And that's why it's so nice to have Genesee Health Plan right there to tell you what these options are. And as a matter of fact, I'm on your website right now, and I see a picture of Tammy along with 5 others in the phone bank answering the phones. And you have such a great team over there. I have to tell you, I love Shannon Czak. She just does everything, helps me so much. And you have the open enrollment until the 15th, looks like, but you also have vaccine clinics and testing sites, and you have Medicare educational resources. You have so many of the things offered there, don't you?
Yeah, and so I think, like, you're looking at the website, I would encourage people to do that, GeneseeHealthPlan.org. There are so many things that we can assist people. But we just had like a drive-through immunization clinic in September, where people can get their flu shots. They got flu shots and their COVID boosters. And we really specialized at that one, Stephanie and Jay, on the deaf and hard of hearing community. I know they probably aren't listening to this podcast today, But that's been a group that has been kind of neglected in our community as far as their health care. They've had to scramble. Just think how hard or difficult it would be to access health care, to go to an appointment, and you can't understand a word that's being said. And like going to the dentist office, not being able to hear the commands of the dentist and so forth. So at that particular event in September, we worked with Communications Access Center to provide interpreters here so they could explain what kind of immunizations, what kind of shots were available, and what to expect and so forth. So those are the type of things that I'm very proud of, those efforts to make sure that all the populations in our community can have access to health.
You really should be proud of that, Jim, because you had so much offered that day. You had free ice cream for the kids. You had school supplies to give the kids. You had a clothing closet there if they need clothes for school. Yep. You just do so much for the community. People don't realize. That's why I love doing these podcasts and bringing awareness to these wonderful services you have. And I have a question for you. I see on your website, it says free stroke screenings. That's really important. And it says here there on the 4th Thursday of each month from 9 until 1. Is that still happening or is that in the past?
Well, no, those are with our partner at the Genesee Free Medical Clinic.
Okay.
And so people can go there to get a free stroke clean. And we're very good partners. And they do the screenings there. And but we also have other programs. If there's women over there that are 40 and above, we have a specific health navigator, a case manager that works specifically with women, making sure that they have their mammograms and all those women visits that are so helpful in detecting cancers and then making sure that they're connected if they have chronic health conditions to healthcare and even things like the farmers market and food and all those things. So it's so important for women to take care of themselves, to get those preventative services. And we're in that. We were in that month for breast cancer awareness month. That was last month, and so there should not be a woman in Genesee County who doesn't have access to health care. So, and men and children. So pass the word around. If there's somebody that you know who says to you, I don't have any health insurance, there's no reason for that. Have them call us and we can help them.
Well, I cannot tell you how many people I have helped. I've taken down there by the hand and took them inside. The one young girl had lost her mother and her father and her sister to COVID, and she was just beside herself. She was a ray of sunshine, and yet she found herself in a very dark place. I took her down. You guys got her so much help because she didn't have any kind of insurance. You were able to help her get her mammogram, and you were able to help her get the emotional therapy that she needed. And she's doing so much better now. And you're able to do it through Zoom with her as well. So that really helped her. So you guys you saved her life.
Oh, I'm so glad to hear that. I love that story because that's something that we had to change during COVID. Like everybody else, we kind of shut down. And then our work has always been mostly face-to-face. Come into our office and we'll assist you. Well, with COVID, one thing that has come of it that I think is positive, if you can look at it that way, is that we can help people virtually now. We've set up like a Zoom-like feature where you can interact one-on-one with one of our staff members virtually. They can see you, you can see them, and you can share information. A lot of times we require like proof of income and pay stubs and all that in order to qualify for these things. We get those, and it's a very seamless process. So we kind of have evolved into a virtual world because of COVID, but we're going to stick with these things because it works for a lot of people that way.
It really does, Jim. It helps so many people if they can't get out of their house, they can't get to you. And I know that people might think, oh, I make way too much money, but not necessarily. It looks like you can make almost $30,000 a year and still get the help that you have for them. So
programs have different income eligibility, whether it's Medicaid, Medicare, Genesee Health Plan, the Affordable Care Act. So no, someone should just see. And one of the things when the Affordable Care Act came out in 2014 and the first 4 or 5 years, what was the criticism? The Affordable Care Act wasn't very affordable. People's insurances were very high, that they had to pay out of pocket. a lot of people said, I'm not dealing with this, I'm dropping my coverage. Please call us back and give it a chance. They've made some changes over the last few years that have made it a lot more affordable and not as many out-of-pocket costs, or people get tax credit or premium credits. If you're one of those people who just gave up on this a few years ago, I would strongly encourage you to call us back. We might be able to find something that's affordable. And what's nice is that we go over all those things with you. You're educated on all your options, and then you can make a decision that's best for you and your family.
I absolutely agree. That's wonderful. I know when I had the Genesee Health Plan, everything was covered. I think the biggest bill I may have received was $5. And then after I got my job at MTA, which is wonderful, and we have the insurance you can pay for there, I didn't need the Genesee Health Plan any longer. But I must say, I missed it, because when I went to the, I went to the after hours clinic because I had shut my finger in the door. It was really painful. And they said, "Oh, I see you have Genesee Health Plan." I said, "Oh, no, that's my old card. I have this one now." She goes, "Oh, it's too bad, because it would have been free with that card. But let's see, your bill here is $250. It's like, with my insurance?" And she's like, "Yeah." I thought, "Oh, okay." So it was very nice.
We do have a couple urgent care visits that we cover, but again, we don't cover things like inpatient hospitalization, emergency. Sure. So I would never want someone that's full insurance. And if you have full insurance, bless you. That's so important, so that
absolutely,
no matter
let's go to the hospital.
What happens to you, you have the ability to have those bills covered. We do the best we can with a healthcare coverage that's mostly outpatient, but it at least hopefully will be more preventative. You won't need those services, but services like you had mentioned we have a couple urgent care visits that can be covered as well.
Right. No, it was really wonderful for people that couldn't afford it. That was great. I was working. I could afford the bill, so it was fine with me. But I just realized how useful, how helpful the Genesee Health Plan is for so many. And so many of the things that you're doing. So yes, please give Genesee Health Plan a call. Find out if they can help you, your neighbors, your loved ones, because they're out there for you. And another number I was going to give you guys too is number 211. You guys can call 211 at the best resources. They will tell you about Genesee Health Plan. They'll tell you about other, maybe if you need mental health coverage, if you need some help that way, they can tell you where to go. So we have so many resources out there, don't we?
We do, and we have great partners like for mental health, Genesee Health Systems. They're not Genesee Health Plan, but Genesee Health Systems. They do a tremendous job addressing the mental health issues, and so they're a partner of ours, and we make sure people can get into treatment there that need it. So,
well, we love working with you because you use MTA to get your clients transportation too, don't you?
Absolutely. So rides to wellness is important to us, or your rides, anything that can get people to their medical appointments and not have those barriers. Because it's not only medical appointments, seeing the doctor, but then it's usually follow-up visits. They have to go to the pharmacy, they have to go to physical therapy or whatever the issues are. So there's a lot of, and if you don't have a car, good luck but one thing is that we have this resource in our community, MTA, and what I always say is MTA gets it. They understand that there are these barriers, and that's why over the years MTA listens to the needs in the community and then adjusts. That's why they've created rides to wellness and rides for veterans and your ride, all these ways that people can get to their appointments so that they can be healthy. It's so important. I'm
so very proud to work at MTA. I know you are too, Jay, aren't you?
I am too.
Yeah, we all are, because they also gave free rides to anybody who wanted to go out there and vote on November 8th to make sure they could get that was through the fixed routes and through your ride. So wonderful. We just want to make sure people get to where they have to go. And during COVID, I don't know if you guys realize this, but Mr. Bennington arranged it so that all the rides were free. So if you had to get to the pharmacy or the doctor, we didn't want that to be a deterrent that you couldn't afford it. So we put plastic in between the front and back seats. We had everybody wearing masks and the drivers were wearing gloves. We made sure that they were taken safely to the pharmacy or to the grocery store or to the doctor. And it was all totally free. We delivered water to people's homes. So I'm just really proud of MTA.
Well, those bus drivers are heroes as well. We recognize those people during COVID that worked despite the risk. And those bus drivers, you had to have people driving the bus. So so thankful that they were able to continue to do that. And so, yeah, MTA really came through it during that time.
They really did. I was very impressed with them. So, yeah, that's just, we both have jobs that we can be proud of, which is nice. So definitely we'll be watching for that again. Give us the details. That's November 16th. And at what time?
Yes, November 16th from 5. It starts at the 5 o'clock news on Channel 5 and goes till 6:30. I think that's the last of their 6 o'clock news. And then they'll provide the number that people can call during the phone bank, and so people can get their questions answered. And there's staff from a number of agencies that do enrollment in our community, and we'll be glad to answer those questions, to schedule appointments if necessary, and just to kind of be a sounding board to what are the options that people have if they find that they need help with enrolling or don't find themselves that they don't have any health insurance. What should they do? That team at that phone bank will be able to help them.
Absolutely fantastic. I just love this. And yeah, get your questions written down right now because you might forget them once you get online with somebody. And I like that idea, Jim. They can get the questions, but also make it important to talk to somebody a little bit further detail later on, which is going to be very helpful.
Yep.
All right. Well, thank you, Jim. I know you're a busy boy. You have another appointment to go to, so I'm going to let you go. And I want to say thank you for being on. Was there anything last minute that you wanted to cover that maybe we didn't get to?
No, just that phone number again. If you need help or assistance from Genesee Health Plan, 810-232-7740.
Perfect. Thank you so much, Jim. And I know many people will be calling, and I'll be watching myself because it's valuable information. I'm not quite to that age yet, but when I do get to be that close to it, I'll be calling you for sure. And you guys can to that number again, 810-232-7740. Now, if you have something just as interesting, something wonderful in the community, Jay and I like to bring it to you every single week with On the Road with the MTA, with Stephanie K and Jay.
That's
so
neat.
If you'd like to be on our show, Jay, tell them how they can do that.
Podcast at mtaflint.org. Just drop us an email.
You've been listening to On the Road with the MTA. For more information on our services and community outreach, visit us online anytime at www.mtaflint.org. And be sure to follow us on Facebook, Twitter, and YouTube. The MTA, your community, your connection, your way.